Hello everyone, Dr. Priyanka Mehta from Diva Women's Clinic, Chennai. I'm an obstetrician, gynecologist, laparoscopic and fertility specialist. So we all plan weddings in a very grand manner, starting from the color of your dress, your accessories, what your partner is wearing and the ambience. But when it comes to planning a pregnancy or planning a baby, we sometimes forget to do that amount of planning. So you would be surprised to know that most of the pregnancies are unplanned, not even in India but even abroad. So there is this concept of preconceptional care or care before you plan a pregnancy. I'm going to talk to you today about 7 important things that you need to think of before you plan a pregnancy, starting from number 1, folic acid, number 2, vaccines before you plan a pregnancy, number 3, screening for any genetic disorders before you plan a pregnancy. Number 4, your ideal weight and age. Number 5 would be any medical conditions like diabetes or thyroid and how to take care of that. Number 6 is your lifestyle. If you're smoking or taking alcohol or any other substance, what to do then. And number 7 is any other medication that you take or any other important history, you have to tell your doctor about that. So the first thing is folic acid. Folic acid is something your doctors will prescribe you, but you may not sometimes know what it is and why you have to take, when you have to take, and how important it is. Folic acid is a vitamin. It's a vitamin B9. It is present in most of the fruits and vegetables, but the quantity is not sufficient, which is going to be needed when you're planning a pregnancy. So you need at least 400 micrograms of folic acid per day. Folic acid prevents the neural tube defects. That means the nervous system of the baby, the cardiac system of the baby, actually it starts forming even before you realize that you're pregnant. That is even before the 4 weeks are over. So that is a time when folic acid is very important. And to build up enough levels, you actually need to start taking folic acid even before you're planning a pregnancy. So even 2 or 3 months in advance, you have to start taking folic acid, 1 tablet per day. Second point is about vaccines. Vaccines are not only for children. Vaccines are also important for adults. Rubella, that's the German measles. Chickenpox, we are all aware of varicella. So these infections sometimes, if you're pregnant and sometimes you don't even realize, like rubella can be a very asymptomatic infection. You can just have cough, cold, very minimal rash, and that can have a very disastrous effect on your fetus and your baby. So be very sure that when you're planning a pregnancy, it could be a second pregnancy also. You may not have got the infection in your childhood or in your first pregnancy, but then nothing stops that. You may even get this infection when you're pregnant for the second time, or you may be exposed to somebody with the infection. So make sure you take your rubella vaccine and the chickenpox vaccine depending on your immunity level, and do that at least 2 or 3 months before you're planning a pregnancy. Flu vaccine is also available nowadays during the flu season between September and March, and this is even safe during pregnancy. Similarly, Tdap, the tetanus vaccine, diphtheria, pertussis vaccine also is important, can be given during pregnancy also because it even passes immunity to the baby. Then we come to next thing, which is your genetic disorders. Sometimes there are certain genetic disorders which run in the family, like sickle cell anemia or cystic fibrosis, thalassemia, especially sometimes in the northeastern part of India or West Bengal when we get patients. So there is a higher risk that these diseases are a little more common. So you need to make sure that you have screened if there is a family history, or if you have a doubt. All of this can be found out by a very simple blood test. Then comes your weight, your age. So the right age for getting pregnant actually is between 22 and 24 or 26 years. But that is a time when you are taking care of your careers. But then make sure that your obstetric career also takes off much before you're either 35 or 40, because as you age, the chances of getting pregnant become less. The right weight for pregnancy. Here again, if you are obese, if your BMI is more than 30 or more than 35, or your weight is crossing 80 or 90 kgs or 100 kgs, then not only is there difficulty in conceiving, but when you conceive, there is a risk of miscarriage, there is a risk of stillbirth, there is a risk of anomalies, there is a risk of developing high blood pressure or preeclampsia, also risk of developing high sugar. So make sure that if you're planning your pregnancy, you optimize your weight. Smoking, alcohol, lifestyle. What do you do if you are smoking? Please stop smoking. You will not only find it difficult to conceive, also smoking is bad for the baby. Alcohol, again, a big no-no during pregnancy, so please stop it. And the same goes for any kind of substance abuse. And lastly, the seventh point we come to is the drugs. Sometimes some girls, because of acne, they take all these skin medications which contain the vitamin A creams or isotretinoin tablets are there. So these are teratogenic. Sometimes you're taking some other medication for high blood pressure, so like atenolol, and these drugs are contraindicated during pregnancy. So please make sure that like you plan your wedding, like you plan your friend's wedding also, and like you plan so many other things in life, don't forget to plan your baby and visit your obstetrician and gynecologist at the earliest for a pre-pregnancy checkup. Hope you like this video. Please do like, subscribe, share, and please give your valuable comments, and let's spread more information and stay healthy.